Also there it says
It's not
preview, but how to
apply it actually. There's an apply button below.
below?
Yeah, just below that images you see, na? When you select that virtual background image.
Dr. Basan Raju, I think we can start now.
Yeah. Is Shilpa not joined?
She'll join. I've spoken to her. She's joining, but we'll have to start at 5 sharp.
Sure. Let's start.
Yeah, starting now. Thank you.
Okay. Thank you. Okay. Good evening, all. At the outset, I welcome all the engaged and enlightened audience from different parts of India, different sectors, and also from overseas. Participation is the focus of this session, and I dedicate this session to all of you. It's indeed a privilege to be a moderator in the conference of this nature. I thank DMEO Niti Aayog for having Gram as one of the collaborators of this conference and also for asking me to moderate this session. It's an honor to steer the panel having experts from different disciplines who have closely worked with at the grassroots level. We have Mrs. Shilpa Nag, an Indian Administrative Service Officer from Karnataka today, Dr. Mabala Subramanya from NHSRC, Government of India, Dr. Ananya Samajdar from Gram, Dr. Yogesh Kumar from Samarthan. I welcome all the panelists and will talk more about them a little later. Welcome you all. And I am Dr. Basuraj Shrestha, serving as an Executive Director of Gram. I would like to introduce myself as a public policy enthusiast and believer of people's ability at the grassroots. I say this because I have experienced how program implementation can be a cakewalk if you engage stakeholders, or how it can become a rope walk if we do not prioritize engaging them. At Gram, our endeavor is to encompass people's voice in public policy through evidence-based policy engagement. Friends, there's a saying in management. Peter Drucker says, and I quote, "You can't manage when you can't measure." We can't know whether or not we are successful unless success is defined and tracked. In development, I personally feel process is the most important aspect. We often fail in developing and ensuring efficient and pragmatic processes. In order to transform policy intent to outcome, it is the process that matters the most. Planners plan with all meticulousness. Implementers are required then to devise and contextualize the processes and aligning those processes to the need and dynamics of community while implementing the programs. We often talk about stakeholders' involvement in planning and implementing public policies. Also, we often fail to involve them as a true stakeholders. We reduce their involvement to be a mere beneficiaries or recipients of services. Traditionally, the monitoring and evaluation has been the domain of experts who measure performances against preset indicators using standardized procedures and tools. But in contrast, participatory monitoring and evaluation involves primary stakeholders such as end users on the ground and members of the community as active participants. In today's session, let us try to understand from our learned panelists and their take on participatory and citizen-centric approach to monitoring and evaluation. In this session, let us understand the major participatory citizen-centric monitoring approaches that are being implemented or experimented in different development domains. Distill some of the common features, enablers, and challenges of participatory monitoring and evaluation, experiments across different development sectors. Unpack the institutional and design features of such mechanisms and the contextual elements that shape the effectiveness of such mechanisms. Understand major successes and shortcomings of these approaches and mechanisms. That includes the gap between intended and actual functioning of these processes. Friends, so let's have a wonderful session, next 1 hour, and engaged 1 hour for all of us. We'll have this session till 6:15 p.m. Our panelists will speak for about 5 minutes in the round one. And I'll ask some of the supplementary questions while our participants, that is you, are thinking and posting questions on Q&A module. Please remember to use the Q&A platform to post your question. Please do not post the questions as comments. Our first panelist of the day, I hope I have Shilpa Nag logged in.
Yes, Dr. Basuraj, right here.
Yeah. Our first panelist is Mrs. Shilpa Nag, is an Indian Administrative Service Officer of the Karnataka State Cadre. She is presently the Commissioner of Rural Development and Director of the E-Governance, Rural Development and Panchayat Raj Department. She has previously served as Commissioner of Panchayat Raj and Rural Development and State Surveillance Officer, Karnataka, Omicron, Commissioner of Mysore City Corporation, Director of Abdul Nazir Saab State Institute of Rural Development, and her education qualification includes MBA, postgraduate diploma in human resource management. But more than this, I've had a chance to witness her ability and commitment to participatory and citizen-centric approach during COVID at Mysuru. IAS Officers Association even appreciated her dedication, and a photograph of her consoling the mother of a driver who was serving in the city corporation, who unfortunately succumbed to COVID and mucormycosis, gone viral, and that shows a real commitment to engage with people across classes. It's a privilege to have you on this panel. And let us now hear Mr. Shilpa Nag on making social audit and other M&D processes more participatory at Gram Panchayat level.
Thank you, Dr. Basuraj. In fact, it was very kind of you. Thanks a lot. And I'm really happy to be part of this esteemed panel. And I'm really happy to be, hearing others' thoughts as well. Because we in government should be open to feedback, and the more grassroots level feedback that we get, I think we can better implement policies and programs. So let me just start with a brief background about myself, because I belong to the 2014 batch of the IAS, and I have served in urban governance as well as revenue departments. But half of my career is mostly in RDPR. So I've served in different capacities at the district level as a Chief Executive Officer of Zilla Panchayat Haveri. And like Dr. Basuraju was mentioning, I've headed the SIRD, and I've been Commissioner Panchayat Raj, right now Commissioner Rural Development. So, and also Director E-Governance in RDPR. So I believe that, in a very humble way, I wish to make an observation that I think I just got a little bird's eye view from different spaces. Right now I'm at the state level where I'm actually in charge of monitoring and implementation, but I've also been an implementing officer on the ground. So with that experience, I would like to make a few points. So even though I'm Commissioner Narega, basically I take care of Narega in a larger context when it comes to RDPR, I would take Gram Panchayat as a unit here, because that is the grassroots level democracy we all look at, and participation of people in M&D at GP level is what I'll be broadly talking about. So Karnataka has had a good history when it comes to implementation of e-governance, using e-governance in M&D processes, as well as participatory citizen governance, whether it is planning or implementation or monitoring and evaluation. So in 2002 to 2003 itself, I think before social audit concept came about across the country, Karnataka had a concept called the Jamabandi. So basically, Jamabandi is nothing but people's audit, which was supposed to happen once a year, every year between August 15th and September 15th, annually. All the schemes that are implemented by the Gram Panchayat, all the inflows of revenue that has come from various sources, whether they've come from Government of India funds, Government of Karnataka funds, or own source of revenue through taxation and other fees. All the inflows that are there and all the expenditure that the Gram Panchayat has done. So this kind of an account that will be placed before the people. So Jamabandi will be announced well in advance. So the people will actually gather in the form of a Gram Sabha. And then the PDO, the Panchayat Development Officer, will present the statement of account in front of the public. So this was a concept which started in 2002-2003 and was happening annually. In fact, when I was a CEO ZP, even the CEO, all the taluk level officers, all the district level officers, we would go and sit in Jamabandi and observe what is happening, whether it has been being done transparently. It should not be a selective process where only few people are called. So the notices have to be actually issued well in advance, and a lot of people participation should happen. Questions will be asked. If required, people can visit, the group as a whole can visit the work sites wherever there are complaints. and look at the quality and quantity of works, the nature of works that have happened, and take corrective measures. So this Jamabandi was something which Karnataka started long back, and it has been happening consistently since then. This was done in the form of a government circular from the state government. So after that, we also got into another sort of a M&D process, again with the help of people participation. That is the results framework document. So it is just like a citizen report card, wherein you kind of assess from 2012-13. We started this in Karnataka. All the schemes, what were the targets, physical and financial, what were the progresses, physical and financial, that has to be done. So completely all the schemes, and one must also know that in Gram Panchayat, again, along with the RDPR department schemes and programs, there are 29 line departments like education, health, agriculture, horticulture, animal husbandry, or everything else. All the schemes come under monitoring of RDPR department only. Gram Panchayat should always be accountable and be supportive in the implementation of all these line department schemes as well. So all the 29 line departments plus RDPR schemes would actually be put in the form of a results framework document, and the state level ranking would be done. Ranking of districts according to the RFD, ranking of taluks according to the RFD, and ranking of Gram Panchayats also within the districts. So this was something I think which we did, and it got good traction. It was as transparent as it could be. And there was kind of a competition amongst, districts and taluks and GPs not to see themselves at the bottom when their neighbors are doing better. So this created a sort of a healthy competition amongst them also. This was something which we tried out. And right now, all of you know that social audit is a compulsory thing. It is a mandate right now for many schemes. Since I actually monitor NAREGA. So in NAREGA, Karnataka, we have a social audit directorate that is established at the state level. And in fact, it is independent of the commissionerate. So commissionerate is not providing any, financial, of course, from the admin funds only, we provide the financial listings as per the mandate, but it is not monitored or controlled by the commissionerate. So there is a chief secretary headed committee who will actually review the directorate, and even the selection is done by the ACS and development commissioner. So basically, commissioner is not in any way controlling the any sort of administrative processes in the social audit directorate. All the works that are taken under NAREGA. Just to give you a perspective, in Karnataka, we have achieved 16 crore percentage for 2021-22. So financially, it comes to around 6,000 crores per annum. So it is a very huge project. NAREGA in Karnataka is a very huge project. So every work that is taken up in every Gram Panchayat, whether they are community works or whether they are individual works, that is actually brought under social audit. So the social audit directorate has its own, director. It has states resource persons. It has district resource persons, taluk resource persons, as well as social audit units at the grassroots level. That is Gram Panchayats. Annually, they go, they conduct a social audit. They summon all the records and documents. They visit the work sites. They make their comments and observations. Place it in a social audit Gram Sabha, which will be chaired by a taluk level officer who is not an EO. So they are not part of RDPR. Taluk level officer will be nominated by the CEO. So they will chair those social audit Gram Sabhas so that there is frankness and freeness in these Gram Sabhas where people can actually raise questions and serious doubts. And all of those compliances are taken. And then they make observations. So some are recommended for recoveries. Some audit paras are there, which can be again on production of documents, they can be closed. But this is done very, very stringently. So social audit Gram Sabhas happen. And after that, what was seen till very recently is that in NAREGA, I think not just in Karnataka, but across the country, more thrust was given on just generation of person days so that people get jobs and all that. But right now, we are focusing a lot on accountability and transparency parameters. Of course, giving jobs to people is very important. Creation of rural assets is very important. Creation of natural resource management assets is very important. But it has to be done in a very effective, efficient, and transparent manner. So to this regard, whatever social audit observations come, whatever social audit recoveries are mandated, we have one level of an appellate authority called the ad hoc committee at the taluk level. And ad hoc committee gives an opportunity to the PDOs and the Gram Panchayat to present their side of the case. And if satisfied, the cases will be dropped. Otherwise, it will be recommended for recovery again. And we have mandated that the recovery should be done within 90 days of that. So PDOs will have to pay. If they don't pay, then the salary will be deducted or any other disciplinary action will be taken against them. So also social audit is mandated for 14th and 15th finance schemes also right now. So similar processes are followed there also. So that is something which we are doing in Karnataka. And we are adding a layer of technology. Since I'm also director e-governance, we are building this ERP solution called the Panchtantra 2, We already have a Panchtantra, which is e-governance platform, ERP platform for all our governance processes. So even through technology, generation of meeting notices, setting the agenda of meeting, uploading, compulsory uploading of action taken reports, all that we are making it mandatory. And all the Gram Sabhas has to be, beamed live on using platforms like YouTube Live and Facebook Live, so that people who can't physically come to the Gram Sabha can also be participating in it. And for before every meeting, action taken report should be there. And Gram Sabhas have to be preceded by special Gram Sabhas like Women Gram Sabha, Children's Gram Sabha, and any other Gram Sabha. So, and Ward Gram Sabhas. So this is something, technology will actually help us to see that Gram Sabhas, even at the grassroots level, happen in a very effective manner, where, only the elites don't capture and have a bargaining power in the Gram Panchayats. Only people who know the Gram Panchayat members are the one who will receive benefits. So we are just trying to make people more and more aware of their rights so they can raise their voice, and every feedback is considered very, very, this thing in a time-bound manner, grievance redressal will be done. So this is something which we are working towards. Of course, the systems are never perfect because government is huge, complex, and messy. But in our own, small ways, we are always trying to bring a change, and we are always open to feedback. And constantly in our Panchayat Raj Commissionerate, we have a Commissionerate for Panchayat Raj where we look at policy reform on an annual basis so that we are keeping in with the times. And no rules or access set in stone. Every time it has to, it can be made better with time and with more inputs. So over to you, Dr. Basavaraj.
Thank you so much, madam. That was really interesting to know more about. Probably, I think we'll get time to in the round 2 to know more about the Panchatantra too, and your initiatives to even cast Gram Sabhas on Facebook, make it Facebook Live so that anybody and everybody can participate from wherever they are. That's a wonderful thing. So thank you so much for those thoughts. Now we have second panelist of the day. I welcome Dr. Ananya Samajdar. Ananya heads research vertical at GRAM, Grassroots Research Advocacy Movement. It's a development research and policy engagement initiative in India. Ananya has handled numerous research and evaluation studies for clients such as WHO, UNICEF, National Health System Resource Center, and Karnataka Evaluation Authority. She mainly, the main research areas are in public health and skill development. She has recently served as a member of Health, Nutrition and Food Security Working Group, Task Force on Tribal Development, Forest Management and MFP Management constituted by State Planning Commission, Government of Chhattisgarh. Ananya will take us through community monitoring for strengthening responsible participation, leveraging information communication technology. It's from her experience from Arogya Shreni, Karnataka, which is now being implemented as Jan Arogya Shreni in Jharkhand. Over to you, Ananya.
Thank you so much, sir. And as the topic itself shows, so the focus really will be on a few elements. So one is community monitoring. I'll be talking about the concept, responsible participation or responsible monitoring, and the use of technology. So these are some of the elements which will come through. So at first, just like to shed light on the concept of community monitoring. So it's called community-based monitoring, the terminology which has come from the health sector, but which is really applicable in a variety of development sectors. So this whole idea of community monitoring is a little different from the traditional idea of monitoring. So traditionally, monitoring is something we associate with experts who come with a pre-decided set of indicators. But when we look at community monitoring, it is taken up by members of the community themselves, as per their own agenda. And community monitoring or community-based monitoring is supposed to have a positive or a constructive orientation, because often we tend to associate monitoring with the detection of faults or fault finding. But community monitoring really is a positive concept. It is concerned with positive feedback, and the community is at the core of it. The community is supposed to be a stakeholder, because often in the development sector we tend to see members of the community as the passive recipients or the targets of services. But here in this paradigm of community-based monitoring, we're supposed to see community as a stakeholder. And community monitoring really is about supportive supervision. So it's about, even if we are discovering some shortcomings or some gaps, it's about how the community can provide support for kind of bridging those gaps. And community monitoring doesn't just stop at that activity of surveillance or monitoring. It goes beyond that. So it's about finding evidence and acting on the basis of that evidence, doing something with the evidence that has been found. So what does one do with whatever one finds from this whole activity of community monitoring? So either you find local solutions to the problems which exist. So or you carry out advocacy for change. You escalate to the authorities who may be able to do something about it. So all in all, community monitoring is supposed to be a force for positive change. So having seen this, understood this concept, let us look at a case study. So the case studies that I would like to speak about today are from the states of Karnataka and Jharkhand. I'll be talking about the Arogya Shreni experiment which was done by my organization GRAM between 2011 and 2014. So Arogya Shreni means health ranking. So it was a rather interesting experiment. I'll be talking a little about that community-based monitoring experiment. So what was the purpose of this experiment or the action research program? It was to see that can the community successfully monitor the health system, because health is something like a technical area. So is it something that the community can do successfully, and can such community monitoring lead to positive changes in the health services? So that was the kind of research question, and we carried out this experiment known as Arogya Shreni. So in which the capacity of certain representatives of the community were built for carrying out monitoring. So who were these representatives of the community? They were the members of the PMC, Planning and Monitoring Committee. This is a community structure which was constituted under the then National Rural Health Mission, now NHM. So the members of the PMC, or Planning and Monitoring Committee, were trained, were oriented in the task of community monitoring, and also oriented about the services, health services, what is a primary health center, what are the services which exist in it. So they were trained for that task, and then they actually participated in monitoring the health services at the primary health center. So how did they do it? They did it by responding to a phone call which came to them. So there was a phone call which came to them through the IVRS system, the interactive voice response system. So the members of this PMC were supposed to answer some questions about the state of facilities and the state of services in their primary health center. So basically what we did was we implemented a system of technology-based monitoring. So on the basis of these responses which came from these community representatives, the scoring of the PHCs, of the primary health centers, was done, and after the scoring was done, there was a ranking of the primary health centers. The location of this was actually in Mysuru. It was done in about 112 primary health centers of Mysore district in Karnataka. So it was a rather interesting experiment, and it led to some interesting outcomes which I'd just like to talk about. So what did we see? What was seen from this experiment? Firstly, improved capacity and awareness. So not only did people become well versed in the idea of nuanced monitoring. So earlier it was like, this is bad, that is bad. So now people are able to say, like, this is what is wrong, this is the problem, this is the specific terms that people learn to kind of monitor their health facility. So they became aware of the services that exist in a primary health center. They became, what are the services supposed to be available, what is actually available. So that improved capacity was seen. And secondly, dialogue and relationship building. So this was really a move away from the adversarial or the confrontational idea of monitoring to monitor, and it led to dialogue. So once the results of this IVRS based monitoring came to the fore, so people started talking, the members of the community, the PMC members, they started engaging in dialogue with the staff of the primary health center, the medical officer and the functionaries of the primary health center, to try to find solutions. So this was, I was talking about how this is a very positive kind of an approach, a constructive kind of an approach. So it led to that kind of dialogue and relationship building between the members of the community and the providers, and indeed between different stakeholders in society. And it led to activities like local solution finding and advocacy. So actually people in the community started coming forward to offer help to address the problem. So if there was a land problem, somebody offered to provide land. If there was a water problem, the head of the panchayat offered to find a solution, to provide a drinking water connection. So that kind of local solution finding started to happen. And in a number of health centers, there was actually a positive change seen in the state of infrastructure and human resources. So those kind of positive outcomes arose from this experiment. it did demonstrate, that the community is capable of monitoring. So the same project was implemented in the state of Jharkhand. I mean, now we're actually in the process of implementing it in Jharkhand. We're calling it Jan Arogya Shreni. And Gram is now an implementing partner to the Nishtha project of USAID and Japaigo. So under the Nishtha project, we are implementing the Jan Arogya Shreni. So earlier it was the PMC, or the Planning and Monitoring Committee at the PHC level.
Ananya, one
Jan
more minute,
Arogya Shreni
please.
we are doing. Yeah, yes. Jan Arogya Shreni is being done at the level of the Jan Arogya Samiti at the Health and Wellness Center. So we are again trying to see whether community monitoring yields certain positive results, whether communities are capable of monitoring. So just the lessons very quickly in a minute. So these experiments like Arogya Shreni have shown us that positive results build the enthusiasm, build the confidence of people for monitoring. It's important to have facilitation by some civil society organizations to handhold, build capacities for monitoring. It has demonstrated the ability of the communities to monitor. It has shown the utility of a non-confrontational approach. The health ranking, the ranking of facilities really stimulated interest. It stimulated healthy competition. That's like an interesting mechanism there to learn from. So we have seen this implemented in Karnataka. We're doing it in Jharkhand. But this kind of an experiment needs to be done in different contexts, different socio-economic contexts, to see the ramifications. Yeah. Thank you. That's from my side.
Thank you, Ananya. One thing,
Thank you.
the entire initiative led to dialogue, which is solution-oriented without having confrontation approach. That's the takeaway. Thank you so much for taking us through Arogya Shreni. And the third panelist of the session, Dr. Mabala Subramanya, I take this privilege to welcome him. He is an advisor of community processes and comprehensive primary health care of Ministry of Health and Family Welfare, Government of India. He is an anesthesiologist by his training, but a comprehensive development professional with his rich experience of 38 years at the grassroots to policy level action in the sectors of health, education, socio-economic development, training, and research. He lived most amongst the indigenous tribal group in Karnataka. He founded and led non-profit organization and pioneered public-private partnership initiatives, some of which are national models in the health sector. Let us listen to Dr. MAB, as he fondly called, on fundamentals for social accountability and social audit. Over to you, sir.
Thank you, Dr. Basavaraj, and thank you, Niti DMEO and Gram, for this opportunity to be amidst you on this day. And thank you for all the audience who have joined us. In fact, when I was listening to Madam Shilpa Nag and subsequently Dr. Ananya, I was reminded of the various dimensions that you look at when you look at accountability itself. And when you're dealing with health sector, how does it change is a question that started lingering in my mind. Is it the same aspect that we would be working on all dimensions? Is monitoring, the purpose of monitoring is very clear. It is for ensuring the impact that is expected out of it, in the sense that it is a concurrent process to do course corrections to realize the impact that we originally intended to. So in that context, I also was very touched by Dr. Basavaraj's comment about Madam Shilpa Nag's relationship with her driver on a compassionate this one, and what touched and what actually moved everybody. And that's health, because it was COVID. We could look at what exactly is. So when I'm looking at accountability in this one, while social audit is a term which is routinely used, audit has a connotation that anything is about fault finding. Okay. So when you're looking at fault finding, you should have a normative one. So you know what is normal, and hence you're trying to find whether something is beyond the normal, or I would say not reaching the normal on either side. So in which case you say that there is a fault and that you need to bring it back onto course. So that is absolutely clear in when you look at social audit. And social accountability is only a tool to actually, or I would say social audit is basically is a tool to actually ensure accountability, if you want to look at. But what is accountability per se is what I want to look at. Accountability is mostly created because you're doing what you're supposed to be doing, because others expects you to do it, and it springs from a very strong extrinsic motivation of reward and punishment, and hence it is very, very suited when there is a created economic interest. So automatically Narega is something which will definitely fit into that system. Everything is tangible, everything is got a parliamentary policy framework, and then there is also an investment which is actually independent of the structures which are actually delivering the program and the receiving the program, and hence this falls well within the limit. But when I come on to a health sector, probably many of you might actually would like to go back to the original concept of health, where health is a state of complete physical, mental, social, and spiritual well-being, and not merely absence of disease and infirmity. This critically underscores the people-centric principle by stating in the declaration itself, the people both have the right as well as the duty. So it is not that people only have a right here, people also have a duty, and they have to participate both individually and collectively to realize the state of health. So in that context, the independence that we're talking about, the economic interest that you're talking about will be little challenged in this circumstance. That is why I would like to look at this context, how we are moving towards in the health sector in terms of accountability. While accountability is an essential factor, the accountability gets better positioned when it actually imbibes the emotional commitment that you saw in Madam Shilpa Nag, which actually ensures that there is an intrinsic motivation, pride, and engagement in the cause, and would do what needs to be done and not what is supposed to be done. And this ownership transformation is what is going to change the way things are happening. So in that context, when social accountability structures, or I would say social audit as a common terminology, where I would say social audit sometimes could even be threatening in terms of a health sector, this one, because more often the system is so complex and so messy, in Shilpa Nag's words, that it is not so easy to overnight change the whole thing. And the poor person at the frontline healthcare level would always be at a target for this one, for scoring each other's points by somebody who has a vested interest at times. So this importance have to be scored, and hence I would look at how to build ownership and pride in engagement, which I think Arogya Shreni to a certain extent tried. And I'm trying to derive the same principle, which is actually another experiment done in northern Karnataka, where the Arogya Mantapa, deriving from the original Anubhava Mantapa, which was heralded as one of the first parliaments of the world, where people get together, share their experiences, understand their needs, and come out with a joint action plan to find solutions. And in this context, I would look at social accountability as an initiative to enhance ownership amongst the community on the public health facility, because this is equally important. Because for non-maternal and child health care, our primary healthcare facilities utilization was an abysmal 11.5%, and it's been slowly being pushed. And in fact, being in the ministry now, I myself have been, I would say, repeatedly narrating or relating to the fact that at least in the next 2 years, we should triple it. Let us reach 35-36% for non-MCH care activities. So utilization comes only when you own the system over there. So this is basically, I would say, audit or accountability, whatever we want to call it, both in terms of semantics, but should be a process which is inspirational both for the healthcare provider team as well as the community team. It is built on a very clear principle of ensuring that there is a process of information which is shared on either side. There is a dialogue that is being nurtured during the process. There is a negotiation which is based on a collective demand than an individual demand. And fourth thing is, which leads on to an important element of trust and collaborative relationship. So the whole factor of audit is more about bringing people together, making them understand together, making them live together, making them accept each other's responsibilities as much as their rights together, and ensure that collectively that we, this joining of hands of the community with the health system would actually bring about a transformation in the health sector, both in terms of utilization as well as accountability. And that's where the paradigm I would look at in a social dimension, whether it's health or education, to come into. And it is also important because this would ultimately become locally adaptable. It will be a low cost process which energizes greater participation, and this will also ensure social inclusivity, which is an essential factor when it comes to health and education dimensions, because it is the marginalized and the vulnerable who are in different things. So how do you actually do it? This narrative is not new that I'm trying to look at, but it is in a new narrative in terms of the emotional commitment that is being brought into the element, not just on economic interest parameters. So in that context, I would like to emphasize the fact that this process has already been started off. The National Health Policy was actually 2017 greatly emphasized the importance of community participation, though the National Rural Health Mission initially in 2005 and National Health Mission subsequently spoke so much as one of the most important pillars of the mission itself as a communitization, which will ensure accessibility, affordability, and quality of healthcare. And this collaborative effort is now being attempted in a much more simplistic, very co-organized factor, which could become a coalition. This is being piloted in various situations. And this is also not because it was done overnight and then that was the reason we actually simply bumped onto this one. There were a lot of audit processes which were tried out in Jharkhand, Maharashtra, Karnataka, Gujarat, and Assam and Meghalaya. When they used the same Narega initiatives directly, actually the results were not as productive as expected to be. It could also be true clearly saying that the health outcomes are more dynamic and requires a greater need for people's ownership and not just the public health facility or the provider's efficiency in that context. So in that way, monitoring has to be a joint effort. Monitoring has to be an effort towards strengthening the system rather than scoring a point on each other. That is something that has come out. And these principles have been now co-opted, and there are multiple actions that have been looked at in this one. For example, in Maharashtra, the community action in health, where NGOs have been involved, incidentally, both in Gujarat and Maharashtra, Odisha, where the NGO involvement or the civil society organization involvement has been there, that has been better performing. This could be because of my own understanding on the principles. Government comes with an authority, or in fact, the very definition of a government is the one which has the authority. Otherwise, it is not called the government. So there is a power hierarchy that kicks in. When it comes to an NGO, this element is actually replaced by more to do with people connectivity. So there is a level of trust and engagement because of the long-term association that gets nurtured over a period of time, and hence gathering people, empowering people to ask questions and relate to the issues, and probably, I would say, sometimes even pacified to the level saying that how collectively they should find solution rather than getting onto a blame game is a probability. And hence, both in Maharashtra and Gujarat studies, which have been documented as well as published, it clearly showed that wherever NGOs were involved, it was in Dahod district in Gujarat. So this experiment was very well documented, where under the MCHK, everything happened according to the mandate, and we were able to see significant changes. The Arogya Mantapa that was done in North Karnataka also brought in a clear mandate of ensuring pregnant mothers coming to the facility or regularly. Second thing, it also ensured tracking of the cesarean sections that are happening versus institutional deliveries that are happening over there. It also brought in a collective effort of the Anganwadi and the healthcare system in terms of Poshan Abhiyan, so that they were able to bring the nutritional component into the pregnant mother and child together. So these elements of examples have been now imbibed, and a new experiment is now being tried out, where it is now getting institutionalized, starting with going to every village with a very cultural context, starting with a very festive atmosphere of or you can even call it as a habba or this one tyohar. So in which case, these people come together, sing a song, get together, then the CHO is able to give out the data about what happened in the month, and then the discussion starts, which is actually on in fact, emotive tools have been made where they have to simply tick a smiley or a grieving person to come out with discussions and ultimately take it forward. Hopefully this, along with collaboration with Arogya Shreni, could actually energize further. I'll take more questions and also the issues of challenges and structural issues in the due course of time. Thank you.
Thank you so much, sir, actually. So what you said, the emotional commitment, that is what required, and what needs to be done is we need to transform social accountability structures build proud and engagement. So to share information, dialogue, and negotiation, which leads to trust and collaborative relationship. Thank you so much for emphasizing those aspects. So now we'll have our fourth important panelists of the day, Dr. Yogesh Kumar, who is a development economist and a founder and executive director of civil society organization Samarthan Center for Development Support, based in India. Dr. Kumar is a member of several committees of state government of Madhya Pradesh, Chhattisgarh to provide strategic guidance on governance issues. He has experience of more than 30 years in local governance and participatory development, with several publications on the issues of people-centered planning, accountability, and transparency. Dr. Kumar has designed and conducted several tools of community-led monitoring of programs, which includes social audits, citizens report card, community scorecards, etc. A training manual of social audits jointly prepared by Samarthan and UNDP was published by Niti Aayog in the year 2015. So let us hear from Yogesh ji on participatory approaches of monitoring and learning in water and sanitation programs.
Thank you, Dr. Raju, and organizers for giving me this opportunity, eminent panelists, and August gathering. Thank you. I think the speakers or the previous speakers have very eloquently explained the importance of participatory monitoring and evaluation. And I will simply put little emphasis that it is important that we realize that why it is necessary that people should come in the center of measuring the performance themselves, because rather than this downward accountability model, we're talking about upward accountability model, where we say that the money is collective, people's money, and therefore the benefits also should flow and should also be measured jointly by the people themselves. So bringing people in the center is the premise and purpose, and it is also important because the larger goals that we fix for any of the program, when we say that we want to make our program sustainable, we want these to be owned by the community institutions, we want community should share the cost. This is not achievable unless we allow people to be in the center of decision making. If they are part of the problem, then they have to be part of the solution. Now, the only difficulty in monitoring and evaluation, why conventional methods have been used over a period of time, is this whole notion of objectivity. We feel that unless independent people come and monitor and evaluate, we might not be able to get the reality. But it is being realized that in spite of those who come with different perspective as independent evaluators, they miss a lot of point of the local context of the people's perspective. Therefore, it is important whose reality counts. If people's reality count in analyzing the problem and finding solutions, I think they should be in the center and we should be the facilitator. It's a transformative departure that we will have to undertake if we really want to promote participatory monitoring and participatory evaluation. Now, I will give a couple of examples, and I think the challenge is civil society has been able to experiment and provide several examples which are of micro nature, where we have to see that how it can be done on a macro level. I'll give you an example of Swakshabarak Mission when we were working in the district of Cascade. It is a highly tribal district of Chhattisgarh, and we realized that the pace of construction of toilet was not going up, and the targets were ambitious. And the realization was that the Gram Panchayats, who are part of the implementation mechanism, are unable to provide correct information. It was more distorted information. In order to get more money, they were just providing a kind of demand that was not actually at that point in time. So with the help of the Swakshagrahis, these were the Barefoot sanitation facilitators created under the Swakshabarak Mission. They were trained. The self-help group women were trained. In each of the village, a team of those were prepared, and they were asked to go and meet every family. And this decision was taken in a Gram Sabha that let us do a kind of an audit of what is the status of sanitation in our village. And they went to each and every village, checked the toilets. If it didn't exist, then they marked it as red. If it existed but what was not in use, they marked it as yellow, or it was dysfunctional for some reason, or there were issues of behavioral change. And wherever there was a toilet and being used, they marked it as green. So all these dots were put in the houses. And if your house is marked with a red or a yellow, it's a shameful this thing. People used to feel embarrassed because so many people are coming, and therefore in small groups and discussions had started taking place. And this was created into a Swakshata Panji. This was a register. So this is the village sanitation register, and based on the number of red dots found, that generated the demand which was discussed in the Gram Sabha, and Gram Panchayat had to send it to the district for the release of the funds. Based on that, the engineers will come that these are the number of toilets to be constructed in this particular panchayat. So this community-led verification process empowered them, one, to take care of their own problems, help others to get these toilets, improve the situation, to providing a more, I would say, realistic feedback to the district administration to do that. 20% of the data that was generated by the self-help groups and the Swakshagrahi was validated by the NSS volunteers. So in every village, we could do it with this large force of volunteers. And as a result, all the toilets got constructed beforehand, and the district was awarded completion of this total sanitation. And they constructed additional 50,000 toilets, which was not in the baseline survey that was done before. So I'm giving these examples that we need to do these kind of experiments on a large scale basis using the volunteers. The same is required at the moment in Jal Jeevan Mission. It's a very ambitious program of the Government of India, where we want to provide safe water to every rural household in a piped water supply, through a piped water supply by 2024. And it's an ambitious task. And whenever the speed of program goes up, there are chances a large number of people will be left behind, or the quality of construction will suffer. And therefore, community-based monitoring is the only way we can control, we can collaborate, and we can provide sustainable solutions to the people. And therefore, all these Swakshagaris, we are trying in certain ways in Indore and many other places, that how these Swakshagaris can now help whenever a pipe water supply system is being designed, to identify where the poverty pockets are, because chances are that they will be left out when 100% saturation will come. They will also identify those houses which are at the tail end, and they might receive very little water, and therefore they will have to depend on other sources. So how can we identify those houses and try to find solutions with the implementers? And third, in order to review the quality, timing, and other things, can we do community scorecards to see the satisfaction level of the people, designing indicators with them, and on the basis of those, can we rate those indicators and find joint solutions with the implementing agency and the community, so that the supply of water is taken care of by the panchayat, is taken care of by the committee, because people will have to pay this water tax. And unless they are satisfied, we will not be able to collect. And we will have to see what are the reasons why people are not willing to pay. And should not these be discussed in the Gram Sabha? And therefore, handing over of the scheme, which is happening on the paper between the Gram Panchayat and the implementing agency like PHED, Public Health and Engineering Department, will become a matter to be discussed in the Gram Sabha openly in a transparent manner, so that people can also provide feedback, whether the tank constructed, whether the pipelines laid, whether the quality of water received is of the satisfactory nature, so that the handing over of the scheme can be done. So that is what I feel is the value of the community-based monitoring. We need a large number of community level volunteers to be trained. We need more resources to be designed in these schemes to be kept for the community monitoring purposes. And we also need a commitment from the implementing agencies to see that we may have to delay the process sometimes in relation to achieve more sustainable goals and more sustainable targets that are meant by these schemes. So I stop here. Thank you for your patient hearing.
Thank you so much, Yogeshji. Those were very insightful, and I like being an SS volunteer myself. So, and you used them in order to monitor existing mechanisms and programs. That's indeed a brilliant suggestions which we can make a better use of existing youth forces. So, yeah. So while we are waiting for questions from the audience, I have a first question to Mrs. Shilpa Nag. In order to strengthen participation in the community, what do you think are the institutional and program design features we must keep in mind while planning the program? Can you share your thoughts on this?
Yeah, let me just continue with my initial remarks. Definitely, I think when it comes to monitoring and evaluation, I think we have all learned over a period of time, instead of creating more and more institutional structures and having more and more bureaucracies, citizen participatory and sort of a grassroots level monitoring and evaluation is the best way forward. In that regard, Gram Sabha, I think, which is the most important grassroots level democratic movement, is something which we are looking at. And through acts and through guidelines already, Gram Sabha has received, a major impetus. Right now, the challenge before us is to how to make it more and more effective, how to make it more and more participatory. Like I was already mentioning, using technology, using monitoring tools at multiple levels. Because how is a Gram Sabha happening? I mean, individually, a commissioner cannot go to each and every village and check if the Gram Sabha is happening. So it can't again be like oversight-based exercise. More and more awareness and more, facilitation that the government has to do in the form of technology tools, in the form of reports and dashboards that can be visible, and putting everything. And Gram Sabha may be one of the forums where people can openly come and express, but making the information available. For example, if the Gram Sabha is making a GPDP plan, if a Gram Panchayat is making a Gram Panchayat development plan to utilize its 15 finance resources, the plan should be made public. The plan should be available on a dashboard or a portal on the notice board of the Gram Panchayat for everyone to see. That is when the identification of beneficiaries, the identification of works can be looked at. So two things. One is that the information, whatever the decisions that are taken, that has to be made public. So that is when people can come and question. And use of technology and other tools. Like I was mentioning, using technology, the Gram Sabhas can be beamed to anyone and everyone. Right now, there are so many participants who are participating in this program. They can ask questions. So even people's voices can be heard at that point of time. So I think this is the way forward for us, Dr. Basavaraj.
Thank you, Shilpa. I would like to ask Ananya, having worked with the tribal communities at the Jharkhand and other communities in different parts of the country, what do you think the factors promote or hinder people's participation in community monitoring, or you can call it as oversight committees also? Whether the community can take an in-depth role in the process?
So indeed, for this answer, we can also go by the framework in the literature and also insights from the ground. So indeed, one of the important factors is the perception or the attitude of the systems, the functionaries or the providers themselves, how they, view people's participation and how do they view the wisdom of the community. That is one. Secondly, when we look at the structures themselves, for example, I was talking about the Jan Arogya Samiti. We would like to see, what is the clarity of the role and the function. Are they equipped with, the powers, and are they given the capacities and the resources that they need to function? And the third is at the level of the context or the societal level factors. So we have to look at the socio-economic, socio-cultural and socio-political factors there. So for example, socio-political, in my the example of Jan Arogya Shreni in Jharkhand, in Khunti district of Jharkhand, there is a particular extremist movement called the Pathalgadi movement, which is slightly coercive in nature, which may have an impact on people's participation. Socio-culturally, whether what are the kind of social customs and social hierarchies that might affect the participation of the less privileged sections. Socio-economic, if there is a lot of poverty and it's difficult for people to leave their work and come and participate. So all these factors, and then there are these, the mobilizer, the role of the enabling civil society organizations, the community mobilizers, those supposed to do the hand holding, capacity building for participation. Indeed, I mentioned that as being a very, very important factor.
Thank you, Ananya. My next question is to Dr. Mabala Subramanya, and this question resonates with one of the suggestion given by our participant Ritu Nandaji. What capacity building, support and facilitation requirement that community needs and government should offer in order to bring their participation truly?
Thank you, Basavaraj. In fact, I would say there are two elements to the entire capacity. One is we need to appreciate the fact that as days advance, what was there in 2005 and 2014 to what is in 2022, community is also evolving and they themselves have got a lot of capacity to actually realize what their needs are, what their expectations should be. And media also has played a critical role in the entire framework. Additionally, if you look at it as a policy framework, there is a clear directional investment, both in terms of intellectual thought process, as in terms of training modules, guidelines, etc., as well as a clear project implementation plan, budgetary allocations for training at various levels. For example, there is a clear training program for the panchayat members, which actually, the Rural Development Ministry spearheads it through the State Institute of Rural Development, and the Panchayat Raj Ministry runs the National Center for Excellence in terms of NIRD. The Health Ministry itself, if you look at that, for the Jana Arogya Samiti, the Village Health and Sanitation and Nutrition Committee, the Mahila Arogya Samitis in this one, all of which has got predominantly people's participation, people representatives, either elected or volunteered, and majority of them being women also, because that's the success this country has seen in terms of the ability to get engaged in social sector issues and hold people accountable and participate in solution finding is also an important element. For that, there is a cascade model of training. There is a pool of national trainers. Every state, depending on the size, has actually got a creation of the, I would say, a pool of state level trainers, which is expected to get onto the cascade model down to the block level by the states with the project implementation plan fund allotment, which is on a 60-40 ratio between Government of India and Government of Karnataka. So these structures are already existing for this one. But again, it is unless until we all make up our mind saying that we want to get engaged on one factor. And secondly, when we mean we are also who sit in the bureaucracy, we are also who sit in the political system, we are also, because the same society's representatives that come everywhere are intent. So there I would definitely feel one is the design intent. How much is the structural framework enabling that and pushing it as a mandate? Then the second thing is also in terms of the trust within the community. There is so much of mistrust between the community, the government, the community and the private sector, the community in this one, and between the private sector and the government sector. This trust building exercise has to take precedence for any capacity to get manifested also. I think this is something that I would strongly go. And finally, I would also want to say that while all these empowerment processes are extremely important, the social accountability by itself cannot be I would say cannot be isolated or the only one which can actually ensure accountability mechanisms. It should act as a good complement and a supplement alongside the existing traditional provided this one, where there is a mechanism of a district level monitoring, the state level monitoring. Those things should not be discounted as far as a public servant is concerned. That should be concurrently taken. People's participation would add necessary to, and then only people will also be satisfied. Services will also reach the level of efficiency. So it is a bi-directional phenomena and not a unidirectional expectation or passing the buck on from government could not do, so private will do, or private cannot do, so people will do. So this issue should also be aborted. Thank you.
Thank you so much, sir. That was insightful. And there's a question from one of our participants, Dennis Ronald. The question is, what kind of processes and tools do you use to assess the impact of your activities on women's rights in your community? Probably Yogesh ji can try to answer this question.
Thank you. I think it's a very pertinent question, and it is important. I think one of the role of the facilitator who's promoting participatory monitoring, I think a couple of roles I would like to highlight. One is to see how to manage the power dynamics, and power dynamics from the caste perspective, class perspective, and gender perspective, because there is a possibility even in a participatory monitoring exercise, many of the people may be left behind who are the most important and who should be the one to contribute maximally in understanding the situation, right? So facilitator's role is extremely important. The second is, when we believe in people's ability to find solutions, when we believe in the wisdom of people, then designing tools becomes far more easier. They have their own ways of making social maps, resource maps, service opportunity maps. They have their own ways of comparing the previous situation with the new one. And they will find ways to do that. But we'll have to create that environment of openness where people's wisdom can flow. We can sit together on the same platform, because shedding our own power and authority is not that easy as a facilitator. So that is extremely important when we can do that. And third is that they should have the trust. I think the previous speaker has number of times emphasized that unless they trust, so building that environment of trust, and that will come only when the most vulnerable people decide to speak up on the accountability questions, and the facilitator is able to protect them on a long-term basis. What happens when the exercise is done, when our maps are done, when the data is collected, we close our bags and go back and never come back. And those who took the risk of speaking in those meetings are later on harassed. And you never build a kind of an environment of trust. So that is important as a facilitator. That's why I'm saying it's a serious business. It's not a ritual. It is not a simple tradition that we have to do participatory monitoring. If we want to get engaged in the business of participatory monitoring, we will have to sit together. And there are a number of ways to design these tools. Yeah. And I personally agree that unless in the whole power dynamics, we keep the gender lens straight and sharp, we will miss out half of the reality while we are doing the evaluation. Thank you.
Yeah. Thank you so much, Yogesh ji. There's a question from Mr. Praveen, and I think Mrs. Shilpana can better answer this. Why government is not promoting platforms like Mygov tailored to the grassroots level public participation? And also, I'll add another question, because you worked in urban local bodies. Why there is lack of transparency on working of urban local bodies? Why can't all the meetings of the minutes of standing committees, councils be in public domain? I posed both these questions to you, Shilpana.
Yeah, thanks, Dr. Basavaraju. Let's start with Mygov. So Mygov is a platform that has been created by Government of India for citizen participation, citizen feedback, a lot of ideation and everything. Definitely, it's not that, it is not being promoted. Recently, I must say that, around 6 months ago, they've also given domains to the state governments also, wherein we can customize Mygov, for each and every state. So the process is on, and definitely multiple platforms are available. Again, it is very technology centered. Working in RDPR, I must say that many times when we sit in urban centers, we take it for granted that technology is accessible to everybody. So it is not about just having a smartphone or a gadget. It is also about networks and connectivity and everything. So one danger of making everything, on bringing them on a platform of e-governance or technology is that sometimes, unwittingly, we may also cut off access to these resources and to these avenues to a lot of people. So basically, along with actually building transparency parameters, along with extending transparency and accountability to technology, we must also kind of take a look at what sort of, technological infrastructure that we have, what sort of accessibility and networks that we have, because that should not be an excluder sort of a concept. So definitely Mygov is also, being a part of state government. And I was talking about Panchtantra too. And currently in Karnataka, we have a website called Panchmitra also, wherein the entire GP profile details, the demography of a Gram Panchayat, the beneficiaries, the individual beneficiaries selected under different schemes, the budget and accounts, everything related to a Gram Panchayat is also available on platforms right now. And Karnataka also has a Karnataka Open Data Initiative, wherein everything that can be seen by the public, there is no need to kind of ask questions under RTI or come and ask for information, unless that is something, national security related information or some personal information about, officials or such like. Everything else should be available in the public domain. Currently, yeah, Karnataka has taken a lot of, time and energy. And also we have a project that is going on called the Kutumba project, the Family ID project, wherein, under one single unique identification number called a Family ID, which is nothing but the Food and Civil Supplies Card ID, all the information that is related is available, and household level information is available for all to see, and it brings in more transparency. So we are getting there. And again, another problem is of the data silos. Every department has their own huge databases. Right now, we're working towards integrations. So definitely, I'm not saying we are already there, but we are actually moving there. I think we are in the right direction, and definitely, I think we will get there.
Thank you so much. Thank you. And it's a long question from Mr. Vijay, but I want a very short answer from you, Dr. Bala Subramanya. Community and grassroots are often treated as monoliths and a homogeneous category, but are rarely so. How do you consider and societal inequalities during implementation? Any examples are to do for planners? That's his question.
In fact, it's a very beautiful question, and I think the answer is inherent in it. We are talking about unity and diversity in this country, so there. So all committees that is envisaged are actually multi-stakeholder, and there is a clear positive discrimination categories, right from persons who have utilized the facility up to gender lens, disability lens, as well as in terms of the marginalized and vulnerable community. In fact, all committees at the grassroots level, traditionally the policy dictates that at least 1/3 of the population committees should be from the marginalized and vulnerable groups, and 50% should be from the women groups. And today, even transgenders and disabled populations and people who have used the facility have also been made mandated. And Jan Arogya Samiti is an example for you right now coming up to the Health and Wellness Center, which is talking about it. Thank you.
Yeah. Thank you so much. In fact, it is very well structured and provided in all the government documents that committee should be inclusive of all the communities and cadres at the society's level. In that way, heterogeneity of peoples are being considered in all the planning processes also. Yeah. The next question is something very specific to you, Ananya. What method has been used to rank PHCs in Arogya Shreni? It's from Sai Ankit. I guess he's
So this is
kind of a statistician. I don't know.
Yes, actually, I think it should just suffice to say that it is based on the scoring. So there was a questionnaire I think administered which had I think about 36 approximate number of questions, and a scoring which was done of each primary health center according to those questions. And also it was not just an aggregate kind of ranking based on the scores which were obtained by the primary health centers. There were also certain thematic areas which were looked into, for example availability of medicines, reproductive and child health. So even the thematic area, there was a ranking provided, and also on the basis of the aggregate scores which were obtained.
Thank you. I don't know. It's a very kind of important question. I don't deny that it's a kind of a tricky question. But I next 1 minute for you, Mr. Shilpa Nag. Then it's my time to conclude the session. There's a question from Mr. Kshitij. It's about corruption. So corruption at the grassroots. While many schemes and participatory framework, all this being established, unless those things are also monitored, people may not get the benefit of the schemes of government. Any suggestions or mechanisms to monitor that as well?
Yeah, very tricky question, and I don't want to make any politically incorrect remarks. But when we understand corruption, so there is a saying that, when decentralization happens, even corruption gets decentralized. So in a way, many policy practitioners, I'm sure the eminent panelists will also agree. Of course, it is not ideal, but it is better at least. But yeah, human beings are selfish by nature. And today, you may kind of be in a position, and when you get that kind of a position and authority, you'll exactly behave the same way as the incumbent is behaving. So I think corruption is again a kind of a cultural context, a kind of a, human behavior issue. And definitely there is corruption, and definitely there are mechanisms to avoid corruption also. So I think the only way to address it, like, the stakeholders themselves should be part of it. For example, if a civil work, a road construction is happening in a village, who are the stakeholders who will benefit? The people who will actually access that road, use that road. So once they are part of, monitoring, then definitely they will want a quality asset instead of, some sort of a short kickback. So when it comes to Anganwadi centers, there is a meeting of mothers, which will be held in a weekly manner so that they can actually resolve all the issues there. So mothers' children are in the Anganwadi. So definitely they want the best for their children. So I think to avoid corruption, to include stakeholders, citizen participation, credible NGOs, organically grown and credible NGOs that are there, which gives a collective voice. Each and every person, it's very easy for us to say that, community participation. It's not easy for a common person to just come and have a voice, or, unless they have their own vested interest. A lot of people, innocent people don't come and even speak up. So I think, these sort of, for example, in Karnataka, we have school development and monitoring committees, again, with the parents also in those committees. So whenever, whatever the, project is there or the process is there, that is directly affecting your community, your house, your child. That is when I think corruption will reduce, because nobody wants adulterated milk for their own children. That is when they will also take care of corruption. So I think, yeah, this will be a long discussion if we continue. I think this can be a panel discussion by itself. But yeah, we should look at ways wherein stakeholder engagement is there. The people who actually benefit by that kind of project or activity should be part of the monitoring and evaluation committee, whether through an individual or a collective voice. And that kind of platform is something which can reduce corruption, if not eliminate it completely.
Thank you so much. That was a brilliant answer. And taking cue from your answer, probably I would like to add is, in any system, there are advantages and disadvantages. While we may find corruption when we decentralize the power, there could also be a contributions from the community. And I would like to say this with evidence. So we kind of nudged a school development monitoring committee to take skating as one of the option in Mysuru. And we provide very minimum basic requirements. But the school development monitoring committee, inspired by that, they went ahead, mobilized resources from Gram Panchayat, mobilized resources from Zilla Panchayat, and built a first skating rink in government school in Karnataka. So it's also a testimony that if you involve people, if you make, as I borrow a quote from Yogesh, who said, if they are part of problem, they should also be part of solution. So if you involve more and more community, I think they can also be a brilliant and excellent contributors. I can go on narrate stories. When SDMCs started initially, people said what they can do, why that is an additional committee. But now we see the benefit of school development monitoring committees at each and every school, especially when we had to manage COVID at every school level. Government clearly and simply depended on school development monitoring committees. So, and Panchayat Raj systems. It was indeed encouraging to know having people's participation augments programs efficiency. Accountability is the necessary factor in delivering public policies. I think we need to see community as a partner in the process of development. Triple R should be the basis of partnership. And of course, our panelists also emphasize that. I'm not referring to the awaited movie of RRR of Rajamouli Garu, but it is respect, recognition, and reward. We need to respect the native knowledge and wisdom of community, recognize their ability to be a collaborator, not just a beneficiary, and reward them for their contribution, which need not be monetary contribution, but a social recognition. That's something I think motivates them and creates a platform for them to participate much more energetically. Government, policy think tanks, academic institutions, civil society organization need to increasingly work together for creating PPP model. Again, it is not our usual PPP. It is pro-people, participatory, and plural model for making our public policies more effective. I'm using plural as an adjective here, which means containing several diverse elements such as diversity, inclusion, affirmative action to ensure our honorable prime ministers as well as incumbent governments to ensure no one is left behind and citizen-centric, citizen-focused governance should prevail. So thank you all the participants. You have been really engaged participants throughout. I once again thank all the panelists, DMUO, Niti Aayog for creating such a wonderful platform to discuss monitoring and evaluation with people's participation. Thank you so much. Jai Hind.
Thank you.
Thank you.
Thank you.